Alert! The silent medicine that's destroying your brain right now. Did you know that a simple pill could be ruining your memory right now? Have you ever wondered why you have forgotten names, appointments, and where you left your belongings so often? What if I told you that the cause is not age, but that medication you take every day? Recent research has revealed an alarming connection between certain common medications and the accelerated deterioration of brain health. Millions of people around the world are ingesting substances that silently compromise their cognitive functions, with no idea of the real danger. The damage can be irreversible if you continue taking these drugs without knowing their side effects. Have you noticed difficulty finding words during conversations? Do you feel like your mind is slower or confused than it used to be? Are you having more difficulty learning new information or focusing on important tasks? The answer to these problems may be hidden in the medications prescribed by your own doctor. In this complete content, you will discover the 13 most dangerous drugs for your brain, including the one that occupies the first place on our list and deserves your full attention. Let's get started. The secret list. 13 medications that wear down your brain daily. Your brain is the commander of all the functions of your body and mind. When your neural connections are impaired, your entire life is affected. Everyday activities become challenges, simple conversations seem confusing, and your independence can be compromised. The list that I am going to reveal was compiled after extensive analysis of medical studies published in renowned scientific journals. Each of these medications has its rightful place in the treatment of a variety of conditions, but their neurological side effects are rarely discussed with patients. The knowledge you'll gain today can be the difference between a future of mental clarity or cognitive confusion. And the scariest thing is that many of these drugs are among the most prescribed in the world. You need to be informed about these risks in order to make informed decisions about your health. Remember, never discontinue use of any medication without consulting your doctor first. Information is powerful, but it must be used responsibly and with appropriate professional guidance. Get ready to find out which substances may be silently compromising your cognition, your memory, and your quality of life. And don't worry, at the end, I'll share strategies to protect your brain without compromising the treatment of your health conditions. What we'll find out below can completely change your perspective on the medications you consume on a daily basis. Number 1. The invisible anesthetics that erase your memory permanently. General anesthetics such as propofol and sevoflurane are essential for modern surgical procedures, allowing pain-free interventions. However, recent studies have revealed a dark side of these compounds that is rarely discussed before surgeries. These substances can cause lasting cognitive damage, especially in elderly patients or those with a predisposition to neurological problems. After surgical procedures, many patients report a phenomenon known as post-operative cognitive dysfunction. This disorder manifests as persistent mental confusion, difficulty concentrating, and significant memory failures. Anesthetics profoundly alter neural communication, and in some cases, the brain never regains its original function. Research published in the Journal of Neuroscience has shown that anesthetics can trigger inflammatory processes in brain tissue. This neuroinflammation interferes with the formation of new neural connections and can accelerate the development of neurodegenerative diseases. Patients with a family history of Alzheimer's or Parkinson's should be particularly aware of these risks. Follow-up studies have revealed that people undergoing multiple surgeries under general anesthesia are more likely to develop early cognitive decline. Anesthetics can also interfere with the production of acetylcholine, a neurotransmitter crucial for learning and memory. This change explains why many patients find it difficult to retain new information after surgical procedures. If you need to undergo surgery, talk to your doctor about strategies to minimize brain damage. Factors such as adequate hydration before and after the procedure, optimized brain nutrition, and cognitive exercises can aid in recovery. While we can't avoid anesthetics in essential procedures, we can take steps to protect our brains from their effects. And remember, closely monitor your mental function after surgery and report any persistent changes to your doctor. The upcoming revelation will surprise many people, as it is a type of medicine found in almost every home. Number 2. The danger hidden in fluoroquinolones that your doctor didn't reveal. Fluoroquinolones such as ciprofloxacin and levofloxacin are potent antibiotics used to fight serious bacterial infections, usually prescribed for pneumonia, persistent urinary tract infections, and other serious conditions. They are considered effective against resistant bacteria. What few patients know is that these drugs can cause devastating effects on the central and peripheral nervous system. The U.S. Food and Drug Administration, FDA, has issued stark warnings about these antibiotics after thousands of reports of permanent neurological damage. Fluoroquinolones interfere with the GABAergic system, which is responsible for regulating neural arousal in the brain. This interference can cause severe symptoms such as extreme anxiety, insomnia, tremors, and even seizures that persist even after stopping treatment. Research published in the journal Neurology documented cases of patients who developed episodes of paranoia, sudden depression, and racing thinking after starting treatment with fluoroquinolones. These antibiotics also significantly increase the risk of peripheral neuropathy, a painful condition where bodily nerves are damaged. Symptoms include tingling, numbness, and muscle weakness that can become permanent in some cases. Because the central and peripheral nervous systems are interconnected, this damage can compromise both mobility and cognitive function. Patients treated with fluoroquinolones for prolonged periods often develop symptoms similar to those of dementia. These include frequent forgetfulness, difficulty with logical thinking, and concentration problems that impact daily life. The use of these substances should be restricted to truly serious infections where other treatment options are not effective. Unfortunately, these antibiotics are often prescribed unnecessarily for conditions that could be treated with safer alternatives. If you must take fluoroquinolones, be on the lookout for any neurological symptoms and tell your doctor immediately. And beware, the next drug on our list may be in your medicine cabinet right now, disguised as a harmless ally. Number 3. Anticholinergics. The Alzheimer's time bomb that may be in your closet. Anticholinergic medications include diphenhydramine, present in many anti-allergic drugs, oxybutynin, and several other common medications in everyday life. These are used to treat everything from allergies and colds to asthma, urinary incontinence, and gastrointestinal problems. The ease with which many of these drugs are obtained without a prescription masks their potential to seriously impair cognition. The mechanism of action of these drugs involves blocking acetylcholine, a neurotransmitter that is fundamental for memory and learning. Studies conducted by the University of Washington have shown that long-term use of these substances can double the risk of developing Alzheimer's. When acetylcholine is blocked for too long, the brain gradually loses its ability to form new connections, compromising essential cognitive functions. This effect is particularly dangerous for the elderly, who already have a naturally reduced cognitive reserve due to aging. Many patients take anticholinergics for seemingly harmless problems, without realizing the silent risk to their memory. Early signs that these medications are affecting the brain include difficulty concentrating, frequent forgetfulness, and mental confusion. The impact can be so significant that some people begin to suspect that they are developing dementia, when in fact the problem is with the medication. In addition to memory damage, anticholinergics can also cause drowsiness, dizziness, and increase the risk of falls, especially in the elderly. These drugs reduce the activity of the parasympathetic nervous system, resulting in slowing of brain and motor functions. An additional concern is that many anticholinergics are available without a prescription, allowing for uncontrolled self-medication. This means that thousands of people may be regularly consuming these substances without knowing their negative impact on the brain. The ideal is always to look for safer alternatives for the treatment of medical conditions before resorting to these drugs. The next drug on our list affects a vital function of your body, but it may be quietly sabotaging your mental clarity. Number 4. The scary truth about calcium channel blockers. Calcium channel blockers like amlodipine and nifedipine are widely prescribed to treat hypertension and heart disease. These medications work by dilating blood vessels and reducing blood pressure, thereby decreasing the overload of the heart. However, by interfering with the flow of calcium within cells, these drugs can negatively impact neural activity in the brain. Calcium is an essential mineral for communication between brain cells, participating directly in the release of neurotransmitters. When their transport is artificially reduced by blockers, the electrical activity of neurons can be significantly impaired. Many patients report a feeling of mental sluggishness and difficulty concentrating after starting to use these medications. A study published in the Journal of Hypertension documented that long-term use of these drugs is associated with reduced cerebral blood flow. This decrease in blood circulation can lead to insufficient oxygenation in certain regions of the brain, resulting in cognitive deficits. The effect is particularly concerning for older adults who are already at increased risk of cognitive decline due to age-related brain changes. In some cases, continued use can increase the risk of vascular dementia, a type of cognitive impairment related to poor brain circulation. In addition to the impacts on cognition, calcium channel blockers can also cause dizziness and fainting, further compromising brain health. This occurs especially when combined with other medications for hypertension and can cause sudden drops in blood pressure. This sudden reduction in blood pressure can compromise adequate brain oxygenation, leading to memory lapses and transient mental confusion. Interestingly, this adverse effect often goes unnoticed, being mistakenly attributed to the natural aging process by patients. If you are on calcium channel blockers and have noticed cognitive difficulties, talk to your doctor about possible adjustments in treatment. Get ready for the next revelation, because it involves medications that millions of people take to alleviate emotional problems without knowing the mental cost. Number 5. The dark secret of tricyclic antidepressants that no one tells you. Tricyclic antidepressants, such as amitriptyline and imipramine, were widely used before the emergence of more modern medications. Although less prescribed today for depression, they are still commonly prescribed to treat insomnia, chronic pain, migraines, and other conditions. The problem is that, in addition to affecting mood, these drugs can significantly compromise the cognitive functions of those who use them. Its mechanism of action involves blocking the reuptake of serotonin and norepinephrine, increasing their availability in the brain. However, they also negatively affect acetylcholine, a neurotransmitter that is fundamental for memory and learning processes. This multiple interference in neurotransmitter systems can create a veritable chemical chaos in the brain, impairing essential mental functions. Many patients report difficulties retaining information, frequent memory lapses, and a persistent sense of mental confusion. These effects may be even more pronounced in the elderly, who are already more susceptible to age-related cognitive problems. Another serious problem with tricyclic antidepressants is that they can cause intense sedation, slowing down thinking and impairing decisions. Some patients describe a feeling of foggy mind, where simple tasks seem more difficult and thinking seems significantly slower. This effect can be particularly problematic for people who require high concentration on their work or daily activities. In addition to the impact on memory and cognition, these antidepressants can affect balance and motor coordination, increasing the risk of accidents. Many people do not realize this connection and end up attributing these symptoms to natural aging, when in fact they are the effects of medication. If you're taking tricyclic antidepressants and notice a negative impact on your cognition, talk to your doctor about alternatives. There are more modern treatment options that offer similar benefits for mood with less impairment of memory and concentration. The next drug on our list may surprise you, as it's widely promoted as a health protector, but it hides a troubling secret. Number 6. Statins, the deadly paradox between saving your heart and destroying your brain. Statins such as simvastatin and atorvastatin are widely prescribed to lower cholesterol and prevent cardiovascular disease. Millions of people around the world take these drugs daily, considering them as essential protectors of the cardiovascular system. What many don't know is that by drastically reducing cholesterol, these substances can significantly compromise brain function. Cholesterol is not only a villain for the heart, it is a fundamental component of the cell membranes of neurons and essential for the brain. Approximately 25% of all cholesterol in the body is concentrated in the brain, where it performs critical functions for cognition and memory. When levels are excessively reduced by statins, communication between neurons can be impaired, affecting essential cognitive functions. Cholesterol is necessary for the production of neurotransmitters, the chemicals that allow neurons to communicate. Research published in the European Journal of Neurology has documented that long-term use of statins can cause memory difficulties. Many patients report a feeling of mental fog, with difficulty concentrating, frequent forgetfulness, and loss of mental clarity. These symptoms usually appear gradually and therefore are not always associated with the use of the drug by patients or doctors. Another significant problem with statins is their impact on the production of coenzyme Q10, a compound that is essential for energy production in cells. The reduction in the levels of this substance can lead to mental fatigue, feelings of constant tiredness, and persistent cognitive difficulties. As the brain is one of the most energy-consuming organs in the body, any interference in this process can affect clarity of thought. Some research also suggests that statins may increase the risk of depression in certain patients predisposed to psychiatric problems. This is because cholesterol is also essential for the formation of the myelin sheath, the protective layer that surrounds neurons. This is just another example of how a drug can help a part of the body while silently harming its brain. Number 7. The silent addiction to benzodiazepines. That's robbing you of your mental clarity. Benzodiazepines like diazepam, lorazepam, and clonazepam are widely prescribed to treat anxiety, insomnia, and seizures. These substances work by intensifying the effects of GABA, an inhibitory neurotransmitter that reduces brain activity and calms the nervous system. However, what many patients are unaware of is the devastating impact these drugs can have on the brain in the long term. Studies published in the British Medical Journal have shown that long-term use of benzodiazepines significantly increases the risk of dementia. This risk is particularly high for people who use high doses, or use it continuously for periods longer than 3 months. Benzodiazepines reduce neural activity and, over time, prevent the brain from forming new connections essential for learning and memory. This interference with brain plasticity can accelerate cognitive decline, especially in the elderly or people with a genetic predisposition. In addition to the risk of dementia, benzodiazepines can cause anterograde amnesia, where the person cannot form new memories while on medication. It is common for patients who use these substances to report frequent episodes of forgetfulness or memory lapses after taking them. This is because these drugs directly affect the hippocampus, a brain region that is fundamental for the consolidation of recent memories. Another alarming effect of benzodiazepines is the significant increase in the risk of falls and accidents, especially among older people. As these medications cause drowsiness and reduced motor reflexes, the likelihood of losing your balance or having accidents increases. This risk becomes even greater when combined with other sedative medications, potentiating depressant effects on the central nervous system. Many people end up getting stuck on benzodiazepines for long periods without realizing the damage they are doing to the brain. Weaning from these drugs needs to be carried out with medical monitoring, as abrupt discontinuation can result in severe symptoms. The next drug on our list is known to help people with autoimmune conditions, but with a rarely discussed neurological price. Number 8. Interference. The brainstorm that triggers depression and confusion. Interferons such as interferon beta-1a and interferon alpha-2b are drugs used in the treatment of autoimmune diseases and viral infections. They are instrumental in the treatment of multiple sclerosis, hepatitis C, and certain types of cancer, saving countless lives annually. However, these powerful immune system modulators can have devastating effects on patients' brains and mental states. Research published in the New England Journal of Medicine has documented that up to 40% of patients treated with interferons develop severe depression. In addition to depression, these medications often cause extreme mental fatigue, difficulty concentrating, and significant cognitive changes. The brain and immune system are closely linked, and when interferons activate the immune response, they trigger destructive neural inflammation. This neuroinflammation can manifest as mental confusion, slowness in thinking, and difficulty processing and retaining recent information. The phenomenon is so common that it has received a proper name among health professionals: interferon-induced brain fog. Patients treated with these substances often report feeling emotionally exhausted and lacking mental energy for everyday activities. This side effect can be so significant that many require antidepressants to balance the neurological impacts of treatment. In addition to mental fatigue and depression, interference can compromise brain plasticity, the brain's ability to adapt and regenerate. As a result, patients may experience persistent difficulties in learning new information or processing complex stimuli. These cognitive deficits can significantly compromise professional and social performance, affecting all aspects of daily life. Prolonged use is associated with severe neurological symptoms such as tremors, dizziness, and even episodes of intense confusion and disorientation. Although temporary in some cases, these symptoms may persist even after discontinuation of treatment in particularly susceptible patients. And now, beware! The next drug directly affects the functioning of your immune system and the body's response to inflammation. Number 9. Corticosteroids, the hidden price of controlled inflammation. Corticosteroids, such as prednisone and dexamethasone, are powerful anti-inflammatory drugs used to treat a variety of serious medical conditions. These medications are essential in the management of autoimmune diseases, severe allergies, asthma, and various forms of chronic or acute inflammation. However, its prolonged use, especially in high doses, can have devastating consequences for the brain and mental health. Studies conducted by Stanford University have shown that corticosteroids directly affect brain chemistry in profound ways. These substances influence neurotransmitters such as serotonin and dopamine, significantly altering patients' mood and cognition. Continuous use can cause atrophy of the hippocampus, the brain region responsible for memory, reducing its volume and compromising its function. Patients who use corticosteroids for prolonged periods are at increased risk of developing permanent cognitive deficits. This degeneration can become irreversible if the drug is used for long periods without proper medical supervision and monitoring. In addition to structural damage, corticosteroids can cause symptoms such as mental confusion, intense anxiety, irritability, and severe insomnia. This is because they increase levels of cortisol, the stress hormone, interfering with the balance of brain neurotransmitters. Patients taking these medications often report dramatic mood swings, moving quickly from euphoria to major depression. These emotional ups and downs can negatively affect personal and professional relationships, significantly decreasing quality of life. Another worrying side effect is decreased neurogenesis, i.e., the brain's ability to produce new nerve cells. This reduction in the brain's regenerative capacity makes it difficult to recover from brain damage and can accelerate cognitive decline in the elderly. The risk becomes particularly high in patients with pre-existing neurodegenerative diseases such as Alzheimer's or Parkinson's. You would never guess that the next drug on our list, used to help you sleep, could be destroying your memory. Number 10. The trap of non-benzodiazepine sedatives that erase your memories. Non-benzodiazepine sedatives, such as zolpidem and zopiclone, are often prescribed for the treatment of chronic or occasional insomnia. Unlike traditional benzodiazepines, these medications were developed to have a more specific effect on sleep. Marketed as safer alternatives, they promise fewer side effects and a lower risk of addiction than their predecessors. However, recent research published in the journal Sleep Medicine reveals significant neurological risks associated with these substances. These medications can cause mental confusion, memory loss, and greatly increase the risk of falls, especially in the elderly. Acting on GABA receptors in the brain, they directly interfere with the consolidation of memories during sleep, a crucial phase for learning. Patients who use these sedatives frequently may develop difficulties remembering recent events or assimilating new information. One of the most serious risks associated with these medications is anterograde amnesia, a condition in which the person cannot form new memories. There are documented reports of patients performing complex activities at night, such as walking, eating, or even driving vehicles. Surprisingly, the next day they have absolutely no memory of these actions, creating potentially dangerous situations. This phenomenon, known as drug-induced sleepwalking, poses a significant risk, especially for people who live alone. In addition to the impacts on memory, these sedatives dramatically increase the risk of falls and fractures, particularly in the elderly population. Because they cause muscle relaxation and reduce reflexes, they can cause a state of disorientation when waking up during the night. This disorientation makes it more likely that the person will lose their balance or get confused in familiar environments, resulting in domestic accidents. Prolonged use is also associated with changes in the natural architecture of sleep, reducing phases of deep restorative sleep. The next medication on our list may be in your bathroom right now, disguised as harmless relief for digestive problems. Number 11. The devastating effect of urinary incontinence medications on your brain. Urinary incontinence medications, such as oxybutynin and tolterodine, are widely used to treat overactive bladder and improve quality of life. However, studies show that its long-term use can increase the risk of dementia by up to 65%, especially in the elderly. This is due to the anticholinergic effects of these substances, which block the action of acetylcholine, an essential neurotransmitter for memory, attention, and learning. The continuous blocking of this substance compromises the brain's ability to form new connections and retain information, accelerating cognitive decline. In addition to memory, these medications can also cause drowsiness, mental confusion, dizziness, and disorientation, increasing the risk of falls and accidents in the elderly. These symptoms are often mistaken for natural aging, when in fact they are adverse effects of the medication. Another serious impact is on sleep. By unbalancing neurotransmitters, they can cause insomnia or impair deep sleep, which is essential for brain health and memory consolidation. Fortunately, there are less harmful alternatives, such as dietary changes, pelvic floor exercises, and bladder re-education techniques that can treat incontinence without compromising the brain. Number 12. H2 blockers. How your heartburn medicine is burning your neurons. H2 blockers, such as ranitidine and cimetidine, are used to treat reflux, gastritis, and ulcers by relieving stomach acidity. However, its prolonged use can negatively impact the brain and cognitive function. Studies indicate that these medications interfere with the production of neurotransmitters important for memory and concentration, increasing the risk of mental confusion and dementia. One of the main problems is the reduction in the absorption of vitamin B12, essential for the production of myelin, the protective layer of neurons. Deficiency of this vitamin can lead to memory loss, difficulty focusing, hallucinations, and slowness in thinking. In addition, these medications affect the absorption of magnesium and iron, nutrients crucial for brain chemical balance. A lack of these elements is associated with a higher risk of depression, anxiety, and mental fatigue. Studies also show that H2 blockers can impair cerebral blood flow, reducing oxygen supply to critical regions of the brain. This can cause recurrent episodes of confusion and disorientation, especially in older people. Long-term users should be aware of these symptoms and discuss safe alternatives with their doctor, as well as monitor levels of essential vitamins and minerals. Number 13. Metformin. The dark side of diabetes management that no one mentions. Metformin is widely used in the treatment of type 2 diabetes, being effective in lowering glucose and increasing insulin sensitivity. Although safe and recommended, its prolonged use can lead to neurological effects that are little discussed. One of the main risks is vitamin B12 deficiency, which is essential for brain function. About 30% of metformin users develop this deficiency, which compromises the production of myelin, a substance that protects neurons. The deficiency can cause irreversible neurological damage, with symptoms similar to those of Alzheimer's, such as memory loss and cognitive difficulties. Studies indicate that patients on continuous use of metformin have faster memory decline and impairment in executive functions, such as planning and decision-making. Another possible effect is interference with the production of serotonin, a neurotransmitter linked to mood, sleep, and emotional balance. This can explain symptoms such as mental fatigue, discouragement, confusion, and memory lapses. These signs should not be ignored or attributed to aging alone. If you use Metformin and experience these symptoms, talk to your doctor. Order tests to check your B12 levels and consider supplementation if necessary as a way to protect your brain health. Wake up now. How to protect your brain and regain your mental clarity. After discovering the possible risks of certain medications for the brain, it is essential not to discontinue use without medical advice. The first action should be to schedule an appointment to discuss the cognitive effects of the drugs in use. Many professionals are still unaware of these impacts, so bringing information can help. There are alternatives with less cognitive impact and dose or schedule adjustments that can reduce negative effects. In addition, natural strategies help protect the brain. Physical activities such as walking, swimming, and cycling increase cerebral blood flow and stimulate proteins that promote neuron growth. Diet is also key. Include omega-3s, antioxidants, and B vitamins, which are found in fatty fish, berries, dark green vegetables, and nuts. Mental exercises, such as learning new skills, strategy games, reading, and language study, strengthen the mind. Quality sleep and stress management are also crucial. Practices such as meditation, mindfulness, and a regular sleep routine have a direct impact on brain health. Protecting the brain should be a priority, even while treating other conditions. With information, medical support, and healthy habits, it is possible to keep your mind sharp for many years.